Hi, I'm Mariam Azmi, and welcome to IJN Heart News. In line with one of its missions to develop and empower talents to enhance organizational growth, the National Heart Institute conducted a Basic Surgical Skills Course (BSSC) workshop on the 19th of March 2022. The half-day event, which started at 8 a.m., was attended by 20 participants from several institutions, such as University Technology Mara, University Malaya, and many more. The workshop covers basic and comprehensive modules, including handling of instruments, needles and sutures, knot tying, incision of skin and subcutaneous tissue, suturing techniques and aftercare, scrubbing, gowning and gloving, local anesthesia and other methods of wound closure.
This is what we call a dry lab. This is something we do like once a year. But we have wet labs we run in this place almost once every other month. We have like 8 courses lined up for this year. And that deals with simulation of different surgical skills that we do as a cardiothoracic surgeon using animal models, animal heart. So we have macam aortic valve replacement, mitral valve replacement, mitral valve repair, aortic root enlargement, coronary artery anastomosis dan sebagainya lah. So we do that all year round. We find that based on the feedback of the participants that they benefit from these courses because they can learn how to do things and they can make mistakes and know how to correct them before they deal with real patients lah. So that's why we do this type of courses.
Surgeons are people who are doing a lot of hands-on work rather than a lot of consultation. We spend a lot of time in the operating theatre. We use a lot of our hands, obviously, to operate on people. So we need to make sure that our trainees, our future doctors, are given that skills. Now that thing is something that you cannot learn from the books, neither watch on YouTube, right? You have to hold the instruments, you have to feel the weight of the instruments, you have to be comfortable with manipulating the instruments so that you can deliver the best surgical care to your patient. For example, when you want to stitch on a patient's heart or on a patient's skin, you've got to make sure that the pressure you put in is enough so that it doesn't tear the tissue, and you have to make sure that when you tie the knot, it's tight enough so there's no leakage, but at the same time it's not too tight that can cause constriction of the tissue, causing damage. So these are skills which you can't read. You need to do hands-on training and exposure.
Apart from the technical component, the workshop also allocated a session to train the participants to lead the operating theatre. This is to ensure that as a surgeon, they will be able to manage the team around them, for example, anesthetists, nurses, and technicians. Aside from the workshop, IJN is able to facilitate trainees to practice their suturing technique, as the Institute has a dedicated space and can provide animal hearts and expired suturing equipment. This is to perfect the trainees' skills before applying them to patients.
About this course, although the duration is quite compact, but it highlights on the most important and essential part of the training program. What I gained during this course is it highlights on the common mistake that usually happens during the basic surgical training. I hope this can correct our bad habit into a good habit, which ultimately can give benefit to the patient.
So to me, it's an opportunity for me to learn the most basic things. Although we've practiced this from the very beginning of our career, however, there are some techniques that are not correctly practiced. So this is the best chance for us to actually get it right and try to make it into a habit in order for us to make our outcome better for our patients. So far, what I can see is that I have noticed that some of my techniques are not really wrong, not really correct. And I've met a few other people from different centers, so we actually can change our techniques and the correct way of holding needles. It's actually really good. And I'm hoping that this course will make me a better surgeon, will make my skills better, and then I'll gain more knowledge.
The workshop was organized by the Education and Training Directorate, Department of Cardiothoracic Surgery. In the future, the team wishes to conduct more basic and advanced courses, where the advanced courses will be geared towards surgeons that have achieved a certain level of competencies and skills. And with that, we end today's Heart News. Thank you for watching. Don't forget to subscribe and stay safe.